please consult with your healthcare practitioner before attempting this protocol. Now, when we're rolling the lower back and the hips, it's not about spinal mobilization as we did with the upper back. It's more about loosening up and massaging the tight dominant muscles that are working against our upright posture. So here we're rolling the erector muscles. So you're not really on the spine itself, you're kind of off to the side. And you never want to go into extension, always keeping a nice tightness in the hip flexors, tightness in your abs. You find a nice tight spot, just hang out there. Work it like a nice piece of dough. And then you also want to do this stance. Trying a little bit of decompression, not going into extension, but trying to straighten your spine out. Still keeping a lot of engagement in your hips, hip flexors and your abdominals to protect your lower spine. You're just hanging out there right where your lumbar spine meets your lower thoracic spine, right where the ribs end. Now you want to get into a figure four, so you're crossing one leg over, and you're not on the bone here, you are in between the sacrum and your hips. So you're in the meat of the muscle there, and you're fishing around into those hip extensor muscles, looking for any tight knots. We don't want to roll mindlessly, we want to look for spots that are actually tight. Again, pain is not always an indicator of that's where you should roll. Feeling pain is okay, because it just usually indicates there's tight muscle, but it could also indicate that the muscle is injured or sprained. And we want to avoid rolling the IT band in this position. It's okay when you're transitioning from the hamstring to kind of pull into that outside quad muscle, working it that way. So you're just on either side of that IT band. That IT band is a ligament, and it's actually technically a tendon from the tensor fasciae lata, which you're going to be rolling up in the hip in the figure four position right here. So you're already getting that muscle. Rolling the tendon is just going to aggravate that. It's going to be painful, and you're not going to get your bang for your buck in that area. You want to roll either side of it. It's okay to push through it as long as you're focusing the muscle, but never directly on the IT band. And since we're rolling the hips here, you don't even really need to get that far into the knee. You're just focusing on more where the muscle mass is. Again, rolling into the quad. You can see he kind of pulled through that IT band into the quad, and you're just going to get a deeper, better stretch. Kind of getting a nice tissue pull instead of going directly onto the muscle. Now you want to finish this up with just flipping on your back one more time, being careful about putting your weight on there. If you're not ready to roll, you can just hang with your butt down and just rest right there, right where your ribs end, and work up to the ability to roll on those muscles. Both sides. You can take it as slow as you want. Sometimes going too fast, you might injure yourself if you got some back pain going on. Overall, if you got too much back pain, you might want to consult with your chiropractor or physical therapist to see if this is the right exercise for you. Nice straight there. You always want to get a little decompression exercise added into this too, so you're actually using those muscles now. You're using that mobility you've created.